Yes, which is 212-246-4237.
246.
4237.
Yeah.
And we have a booklet and a DVD. If they call us at that number, we'll send out a booklet, and they can read about it. They can see examples of liver cancers and other cancers that we've treated and how they respond.
And what is your name?
My name's Dr. Lederman.
Okay. Well, thank you.
Yeah. We were the first ones to perform radiosurgery in the Western Hemisphere, obviously in New York and in America, and we've treated about 20,000 patients. So we have a very large experience treating tough cases like this case. And you're going to hear more on the show today.
It's a shame because he's like, I don't know, he's like in his late 50s or so. And he's such a wonderful person, and
Well, don't write his obituary. You found out about us, and there's options available. So let's not write his obituary quite yet.
Well, thank you.
All right. God bless you, and thank you.
Thank you.
We're going to have a word from a couple new voices, and we'll be right back. And if you have questions, feel free to call us. We're at 1-800-848-9222, 1-800-848-9222. We're live. You don't have to be bashful. You don't have to put on your clothes to call us. You can just give us a ring at the WABC studios, 1-800-848-9222.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based on PSA, Gleason score, and stage. That's why Dr. Lederman's custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid, accepted. Call Dr. Lederman at 212-CHOICES, 212-CHOICES for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212-CHOICES. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212-CHOICES.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal too. He's first in America, first in New York, first for you. With Body Radiosurgery, we hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic, large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212-CHOICES, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
Hey, how a second opinion can save your life. The Good News Department. This man came to us, 66 years old, born in Colombia. He had prostate cancer. He had radiation for his prostate cancer. Then he saw the urologist. The urologist got one blood test that showed the PSA, the prostatic specific antigen, going up, and he planned radical surgery to remove the prostate and seminal vesicles in an area that had been radiated. It would be morbid. It would be the end of his sex life, his urinary life. He'd never be the same again. He was in a tizzy, this man. Last year he came to me. He didn't want that surgery. It was already planned. They got permission from the cardiologist and anesthesiologist and the insurance company. He was headed for, like a train on a track, that surgery. We did one blood test after I examined him and took his history and spent time with him and found, in fact, the PSA was going down, not up. And we saved him a big radical surgery. And he just came in this week, a year after being seen last year when he was headed for that big, terrible surgery. And his blood test PSA is still going down. And he's fully intact. He's sexually functional. He's in remission from his prostate cancer after radiation. Wow, what a difference a second opinion makes. So sometimes if you think, like that woman, that you got a T3 tumor and you really got a T1 tumor, or you need radical surgery because the radiation failed, sometimes it's time for a second opinion, a fresh second opinion. And no, don't go to your doctor and says, Dr. Lederman says this, and then the doctor will say, I thought of that, it's no good. You get a fresh second opinion. You come in. If you've got documents, great. If you don't have the documents, we will find them. We will get the information. We will get to the bottom of it like we get in most cases. We'll give you copies of your documents. You'll understand what's going on, and you'll learn there's options. This man saved his bottom. This other woman saved her life. She avoided chemo. This man avoided radical surgery just by having the facts. Just by having the facts. So go to someone who's got time, that can sit down, close the door, and spend some time with you and get to the bottom of your case and give you documentation. Here's another patient who came in this week, a man, 62-year-old black man with 2 children with a Gleason 8 cancer. And he was scheduled for surgery elsewhere. Now, Gleason is a doctor who tried to tell us how aggressive cancers would be. And if you open up our prostate booklet, you'll see our data to, let's say, the most famous cancer hospitals or hospitals in America. And here on page 15 of our booklet is results of Gleason score 8 through 10 prostate cancer treated with us and 2 famous hospitals in Boston and Philadelphia, fancy-dancy hospitals. Their main results were actually 0. Look at cancer-free survival. 3 of their 4 treatments were 0 success. One treatment was 30% successful for Gleason 8, 9, 10 prostate cancer. Our results, over 20 years, with thousands of men treated, 70% cancer-free survival. So where do you want to be? At the 0 line? At the 30% line, or what I think is the best results in the country, 70% line with us. If you had to bet all your money at a casino in Atlantic City and one casino was offering you 0% chance, would you take it? If they offered you 30% chance, would you take it? What if you knew that you could come to Radiosurgery New York and Dr. Lederman with our published data and have a 70% chance of being cancer-free? Would you take it? And our technique avoids radical surgery, avoids the problems associated with radical surgery, and the poor outcome with radical surgery. Now, some people think, wow, if I just remove that prostate, I'll be home free. Sometimes even the surgeon tells us that. Well, look at the facts. Here's the facts. If you go to the most famous surgeon in America for prostate cancer, Baltimore, Gleason 8, 9, 10, his chance of success is 41% at 5 years and 23% at 10 years. So 80%, actually 77% of men with prostate cancer, Gleason 8, 9, 10, have recurrence of cancer after radical surgery in great hands, not average hands, great hands, 23% success versus much higher, 70% in our hands. So think about it. This man, a 62-year-old black man, thought about it. He came in. He wants to get going. So we get approval from his insurance company. We take most insurances, Medicare, Medicaid. Our best program is treatment in the stereotactic frame and brachytherapy, and where you get it done makes a difference. We'll show you that information too. If you want, we'll send you a booklet and a free DVD. So you can call us during the week at 212-CHOICES, 212-CHOICES, which is 212-246-4237. This is Dr. Lederman, and I was told we have another call, so let's speak to our caller. Ruth in Union, how are you? Good morning. You're an early bird.
Yes, I have a question.
Okay, go ahead.
This was in 1973. I was diagnosed with lymphoma.
I'm sorry to hear that.
I think they said it was reticulocyte. It was the worst type. They had taken it.
Must have not been the worst type because you're here 30, 40 years later.
Yeah,
so.
well, it was because they took it over to Sloan Kettering.
Well, maybe there's other reasons.
Yeah, well, they didn't even have the equipment at New York Hospital.
Well, let's not mention names because we don't like to.
Well, now the question
impugn our brothers.
I had 10 treatments of cobalt, cobalt radiation, and I was wondering. Nobody wants to admit that anybody did anything with cobalt years ago.
That's not true. I treated with cobalt.
Yeah. Is it bad?
No, it's not bad. Why should it be bad?
Oh, well, that's what I was wanting to know.
Cobalt is a form of radiation. It's actually being used today in the gamma knife. So when you go to fancy-dancy hospitals and say they have a gamma knife is cobalt. The gamma knife was developed in the 1950s, and it's still being used, and they sell it for $4 million. So cobalt is not bad, and obviously the radiation, it sounds like to me, cured you. Is that right?
Well, yes.
40 years later, so how bad can it be?
1973.
How bad can it be?
Yeah, but my question, well, that's good. That settles that. The other question I have is, I can't walk since 1975, and I thought in 7 years the body changes every cell in the body, so I was waiting for 2 years.
I'm waiting for 7 years to change all my cells.
Yeah, I'm 82 now, and I still can't walk too good.
Well, I don't know. I'd have to understand where your lymphoma was and how you're treated, but people that we treat not only walk, but talk and carry on and make love and eat and work and other things.
I was fine for all those years. This is my age, I think.
Okay, well, we want you to be healthy, and you're obviously welcome to come in to us if you want to get checked out.
Can I be good at 82? That's my question.
Can you be good for what?
Huh?
Can you be good for what?
Well, can I live?
Well, you're 82 now. What are you doing? You're living now. You lived 40 years.
Yeah.
You were successfully treated. So.
All right. How do I get to your place? Because I can't walk. I'd have to have somebody take me.
You could take a taxi. You can drive in. We're by every train, bus, subway. There are handicap access. You can get on a wheelchair and come in the buses, the subways. We're by PATH train. We're 5 minutes from Penn Station, Port Authority, Grand Central.
Yeah, I could, but I don't have a doctor. All my doctors have died.
Well, I'm still alive.
Yes.
Let me take my pulse. 1 minute. 1,000, 2, 1,000. Yeah, I'm still here.
Then I should not worry about any doctors out here. But
you're doing great. You can come on in. We'll check you out. We'll get your records. We'll stage you up. Make sure everything's okay. Well, that's the problem. We'll get them for you. That's what I say. Most patients don't have the records, but most people should have their records. And
after 7 years?
After 70 years, you should get a ledger and keep all your records.
Yeah, I know. I should, but
it's a mistake. It's your life. You know, it's like your insurance policy. What happened to you, where it was. You know, legally, a hospital doesn't have to keep your records after 7 years, so it's a problem. But I'm just telling you, and everyone, get a ledger and keep all your data, your CAT scans, your biopsies, your mammograms, your pap smears. Just tell the doctor, excuse me, can I have a copy?
Well, will they take my word for it? Because I haven't got a lot
I would take your word. You sound pretty reliable to me.
I am. I would
trust you.
All right. Well, then I'll have to get in touch with you.
Call us at that number, 212-CHOICES, which is 212-246-4237. We'll send you a package about our work, and if you wish, make an appointment for you to get checked out.
Okay. Thanks an awful lot.
Thank you. God bless you.
Okay. Bye-bye.
Bye now. And we get to hear from our sponsor, the band with the golden voice. Call us if you have a question. We're at 1-800-848-9222. Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board-certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom tailored for you. Call 212-CHOICES,